Welcome to Off the Shelf. I'm your host, Yvonne Wolf. Our special guest today is Richard Ling. He wrote a book called Patient Confidential. It is a handbook for patients who need to ask all the questions and prepare their return home after the surgery. Richard is very qualified to write this book because he has almost 40 surgeries or invasive procedures. So Richard, can you tell us when or how did you decided to write the book?
Well, I had had all of these experiences starting when I was 12 years old with surgery on my hips. And it continued on through the years. I've had all variety of things, not just one thing. I've had orthopedic surgery, colon surgery, various things. And actually a very good friend of mine, we've been friends since college, so that's over 50 years, said to me, you have all this experience, you should write a book. And the light bulb went on and I thought, I should write a book. And I've always been interested in writing. I was an English major and I've studied writing at various formats, So I decided I would write the book because I wanted to write, I wanted to get published, and I honestly thought I could help people for whom it's a new experience when I've had that experience already.
Can you compare one of your first surgeries to a more recent experience? I think you had a back surgery?
Yes. Well, of course, medicine is totally different in the time between, say, 1957 and my last back surgery, which was the last surgery of any kind, which was in 2013. It's very hard to describe, but for example, for the hip surgery, I was in the hospital 2.5 weeks when I was 12 years old. Now patients are out in about 2 days for this same surgery.
Wow, 2 days?
2 days. The intravenous was a rigid needle that was put here, and they strapped your arm to a wooden board.
Right.
Now, of course, everything is flexible and moves around.
Disposable.
And disposable. Pain medication was an injection. Now, most often, in my experience anyway, you have a pump that you can manipulate, which is regulated so you can't overdo it, and that's how you get your pain medication. And people know more. And in general, everyone in the hospital, in fine hospitals, and we're lucky to have lots of them here, people in fine hospitals are really much more trained and oriented toward the patient now. Many hospitals have a policy that whoever walks into that room must identify him or herself. I'm Dr. So-and-so, or I'm the nurse, or I'm the housekeeper, and say why you're there and what you're going to do. So that's vastly different from what I had before.
Yes, I can see that. And I also believe the procedures now are less invasive, right? Are they,
oh, absolutely.
The wounds are smaller, or how does that?
Well, again, I can't speak technically to the medical aspects of it, but I remember when my mother-in-law had her gallbladder out, and it was a big incision, and she was laid up for weeks and so forth. And now that same operation, in most cases, I believe, is done through a scope, which makes a couple of little holes, goes in, it's lighted, and it has instruments, and the scope goes in, and they do the repair or the removal of the gallbladder that way, and the person's out of the hospital in a short time and back to work. Because part of the issue, as I understand it, with surgeries is not just the actual removal of the organ or the fixing of whatever you're fixing, but it's the fact that your body is open, it's been cut, there's an incision, it has to recover. And so if you minimize the impact of that, you change the whole experience.
Well, I'm sure you have many stories to share with us, but how do you, should a patient be asking questions? Before,
always.
Right? Before the?
Always, yes.
Always, and before the surgery?
Absolutely, right? Absolutely. And I'm sincere about that answer. I know I jumped on it and said always, but the patient can't be an innocent bystander. You're not. It's your body. You're going to have the experience. Yeah. It's your health that's involved. And I have lots of doctors and lots of very good doctors. And I must say, I've never had a doctor cut me short when I've asked a question or display any sort of impatience like, well, why are you asking me that? I've always gotten a very good answer. And in fact, many of the doctors are preemptive. They give you the information now. They tell you this is what we're going to do and this is why we're going to do it. But in the afterword to my book, I say, if you haven't learned anything else in the book, I hope you learned this. Ask questions, and ask more questions. Because you need to understand, you can't become the doctor, of course, and you can't second guess that final medical judgment. But you certainly can have knowledge in the context of a test, for example. What are the risks of the test, doctor? You know, are there any risks?
And what's the purpose of it?
And what's the purpose?
And
What
why
are we trying
testing?
to find out? And then that gives you, if the answer is, well, there are a lot of big risks to the test, and it's pretty reliable, but we think maybe it'll tell us this, and then you can make a judgment. But it's a team, it's really a team. You know, you need the doctor's judgment, but you need to understand what's going on. And that usually requires asking questions. And what the doctor might think you understand, you may not understand. You're listening to the words, but you don't know what does that mean? What is really going to happen here?
And when you talk about these joint replacements, are there options not to do it? Or are there alternative procedures? Or is that the kind of question we should ask too?
Yes. Oh, yes, definitely that should be asked. I can't give a medical answer to that, but I mean, I can tell you that most joint replacements, I am told, are considered elective. In other words, this isn't, you have cancer, we have to cut it out or radiate it or do whatever, or you're going to die. It's, you don't walk very well, you limp and you're in a lot of pain. You can continue that way if you don't want to have surgery, or you can have the surgery. There are also medical treatments that are sometimes successful, sometimes not. Physical therapy, all of these things can help in terms of a joint replacement, but always asking what the alternatives are is very important.
Can you share with us one story where you feel that you were surprised by what you asked, and you're so glad you asked?
I don't know that I was surprised because I got good answers.
Yes.
Without getting too deep into the details, but at one point a particular procedure was recommended by a cardiologist, an excellent cardiologist. And I asked, well, what are the alternatives? And there were alternatives that were medical. Instead of doing this invasive procedure and pacemaker and so forth, we could use other more powerful medicines. And I said, are there side effects to those medicines? Well, yes, there are. And for some of them, you have to be hospitalized for 3 or 4 days to be observed when you start the medication. It's that powerful and so forth. So there you get answers. You have, you can compare what the alternatives are and make a decision based on that. But you don't know if, in some cases, you might not know if you didn't ask that question.
And you say always ask for a second opinion?
No. I said always ask questions. But second opinions have kind of a bum rap because I think most people think second opinion means questioning the doctor. Thanks for the advice. I'll get back to you. I'm going to go see somebody else. And it's really not that way. It is, every doctor I've told I was going to get a second opinion was enthusiastic. Great. Many of them were able to give me a name in another system. It's not one of their partners or whatever. Go see Dr. So-and-so or Dr. So-and-so. She's at this hospital or that hospital. Because, first of all, anybody can make a mistake. Secondly, medicine is not a pure science. You look it up, you get the value, you do this, you do that. There's judgment involved. And a second set of eyes and a second person making a judgment on what's recommended, and your ability to learn from that person is valuable, very valuable. Occasionally, you find out the first diagnosis was wrong or it missed something. So it has that value, but it's not really reserved for those cases. A second opinion is successful, in my view, even if the second opinion says, yeah, Dr. So-and-so is absolutely right, that's exactly what I would do, and here are the reasons why I would do it.
Well, let's talk a little bit about the writing of
Sure.
your book. You're part of a writers group, and did they help you develop the ideas, or?
Yes, I belong to a writers group. I've studied writing, not for credit or as a degree program after being an English major. That was for a degree, of course. But all of those experiences were helpful to me in learning how to write and in learning how to put the book together. And I had 2 very good consultants who had different particular specialties to help me with the book and made a big difference because writing sounds like it's just you sit down and you write, but it really isn't. Yes, you have to sit down and write and get the ideas across, but you also have to do it in a structure. An example is when I first wrote the book, I wrote it the way everybody thinks of a book, chapter 1, chapter 2, chapter 3. A consultant I hired said, that just isn't friendly for this kind of material, and I recommend that you get rid of that and do them as sections, which is what is in the book, with subsections and a glossary and that sort of thing. And so I switched to that, and I could see immediately that that made a huge difference. So it was the same material, but if you present it in a less favorable, less usable way, you're hurting yourself.
Yes. The organization to how to
the organization,
very
yes,
useful, very
yes.
important.
And I probably went through 10 or 15 rewrites of the book. I mean, it isn't sit down and there's the book, you know.
I see.
Because that's how I think you get the best product you can get. You keep working on it until it really shines, and even there you can look back and find a mistake, you know.
And you say it took you the whole thing probably a year and a half?
I would say about a year and a half from first sitting down and saying, okay, I'm going to write this book, to getting it published.
I see. I like how your sentences are short and to the point, and your book is marvelously short too. Okay, and it's so to the point about what you need to do. How do you prepare coming home before you go even admit it? How has your book helped other people you know?
Well, I'll give you one of the best examples of that. I can give you a few, but when I have a pacemaker. When I had that put in last fall, the cardiologist said to me, you know, I have to have a knee replacement next week. And I said, oh, really? Well, I said, let me give you, the book had not been published yet. I said, let me give you some tips on what you should do before you go for the surgery. And then I told him about, you know, making your house friendly. You don't start moving rugs when you get home and all. You know, you set your house up so it's as risk-free as possible, as accessible as possible, because you're going to have walker or cane, crutches. And he said, thank you. And when he came in the next day to discharge me, he said, you know, I went home and did those things. It's really smart of you. He said, do you mind if I blog about this? Because he had a blog. And I said, no, as long as I can put it on my blog too. And he did. And he called it role reversal and talked about how here he is the doctor, usually giving the advice, but learning from the patient. And I don't mean that to be bragging. We all have different roles in this whole medical experience. The doctor has his or her training, experience, judgment, but the doctor isn't the patient, and the doctor isn't the nurse, and the nurse isn't the physical therapist. Everyone brings something different. And I think the role of the patient in that sense had been somewhat neglected. Although now, as I watch television or read the papers, I mean, regularly there are articles on how to be proactive, be a smarter patient, what you can do to change things for the better for you. So that was the situation. Other examples, two friends. One is actually my son's father-in-law, and another is a very good friend of ours. Both had fairly serious back surgeries, and both of them had the book before the surgery, and had said to me, and I think most sincerely, I'm so happy I read the book. It really helped me to know what to expect and to prepare for it and to do the right thing from the patient perspective.
Well, most of the time, if we know we're going to have surgery, we're so concerned about that day. We don't really think about, right? What time we're going to get home.
Right.
Well, we usually get somebody to drive us home, but after that, we don't know, right? We don't think about it.
That's right. And it takes, certainly not for every surgery. If it's something minor that doesn't incapacitate you, I guess you don't have to do much planning. But if you're walking around on crutches, things like throw rugs in your house can be really, really dangerous. Or you have your favorite chair, but you don't put it in a place you can get to before you go to the hospital, so you come home, and now the chair is over there where you can't get at it. It's just practical things like that in terms of the coming home. And consolidating tasks. You know, you don't get up to do one thing, you get up to do three things. You know, I'll go to the bathroom, get my lunch, and carry the newspaper over so I can sit down and read it.
Yeah. So being part of the experience, medical experiences, are you a little wary about your next, if you have to have another procedure, or do you feel very comfortable with the experiences?
The answer to that is sort of both, and let me explain that. The more you understand and the more you know, and if I say in my book, the first most important task is choosing a good healthcare provider. And I have great ones and I've chosen them carefully. So I know I'm in the best hands that I can be in, and that's comforting. However, I know that things do happen. Not everything goes well, and not only because somebody did something wrong, things just happen. And so I am wary of each new procedure, especially with the numbers. I keep wondering, when is my number up? You know, are we playing an odds game here?
But you had also said that there's a difference between a bad experience and malpractice, right?
Oh, absolutely. One thing that I think this is changing somewhat nowadays, but when I was a kid, if the doctor didn't fix it or you were worse afterwards, it was malpractice. That's what everybody assumed. Mm-hmm. That's not the case. I represented a lot of doctors in their business practices, running their practices, you know. And I remember one doctor, and this is 35 years ago, he did a particular surgery, among other things he did, and he would always tell the patient, there is a 75% chance you'll be better after this operation. But there's a 20% chance that nothing will be different. It won't change anything. And there's a 5% chance that you'll be worse. And that wasn't because he wasn't going to do the right job. Things just happen that way. So there is definitely a difference between that and when someone makes a mistake and hurts you.
Can you tell us about, you write fiction now that you're retired, you say?
Yes, actually, I've written fiction over the years and taken courses in writing fiction. I took one 2-semester course at Northwestern in the continuing education program. The Iowa Writers Workshop runs a summer program of weekend mini workshops and so forth.
They have a very famous writing program.
Yes, and I've gone to a couple of those. I've had one piece of nonfiction published, and I'm working on various other pieces, so I'm interested in that as well. But I've devoted a lot of time to Patient Confidential.
Do you feel that what is most challenging about writing fiction now is different from writing the Patient Confidential?
Yes, I think the thing that's most challenging about writing fiction, as compared to a book like this, is I didn't have to think up a lot of new ideas or figure out what the ending should be, or whether I was getting the right emotional feel, or whether the setting was right in the book. I knew all those things because I'd experienced them. It was a matter of effectively writing them so that they would be meaningful to people. But when you're writing fiction, you know, there's the computer screen, and it's up to you to tell a story. And that's very different. That's a different exercise entirely.
I think you probably use a different part of your brain just to...
I think so. I think so.
Now, you actually call yourself a professional patient.
Yes.
You don't mind being called a professional patient?
No. I thought that after the experiences I've had, I probably qualified. If not professional, at least a frequent flyer.
Yes. Tell us about the full gamut of procedures you had in the hospital.
Well, you're testing my memory. I've had 4 spine surgeries. I've had 3 joint replacement surgeries. I had a foot of my colon removed. I have had numerous other types of orthopedic surgeries. So I really have kind of a broad experience as to different types of surgeries because they all affect you a little differently in terms of your recovery.
So carpal tunnel too, right?
That's right. I had carpal tunnel surgery. I had 5 what they call trigger finger surgeries. So 2 rotator cuffs. I tore both rotator cuffs, had those repaired.
Not at the same time.
No, not at the same time. No.
How did you do that?
And I have a pacemaker, so
yeah. Wow.
Broad scope.
You mentioned that doctors don't know everything.
Oh, yes. Again, certainly many years ago, I think most people sort of thought that you went to the doctor knew, and the doctor fixed whatever was wrong with you. And I think just observing what's happened in medical science over the last 30 or 40 years, genetics didn't exist prior to that. Non-invasive, minimally invasive surgeries where they use scopes and things like that as opposed to cutting you open
amazing.
didn't exist.
Yeah.
Many medical treatments didn't exist. So it's a completely different world. But if you look at it and you look at all the new developments that come out seemingly every few weeks, you realize there's a whole lot more that probably is not known yet by anybody. So it isn't that the doctor didn't study right or figure it out. No one knows it yet. And then they come across it and figure it out. Polio vaccine, back when I was a kid, nobody had figured it out until Jonas Salk figured it out and solved a lot of problems for people.
Yeah, within your lifetime.
Yeah.
I think that's a very good attitude that you have towards this experience, the hospital experience, because you're not accusing them, you're not being skeptical, but just that mere being realistic about who doctors are and who we are.
Yes.
And do you feel you take care of your health better after being a professional? Do you get
Can
more
I take
exercise?
the Fifth Amendment?
Yeah, the exercise that we all supposed to, right?
I know I should. I'm pretty good. I've had a lot of physical therapy because a lot of my surgeries have been orthopedic and required physical therapy, and I stay with the program. I do the home exercises and so forth. I talk in the book about I didn't enjoy a single minute of physical therapy I had, but I never missed an appointment because a doctor, orthopedic surgeon who replaced my hip 25 years ago, said to me, there are very few guarantees in medicine, but he said, I can guarantee you one thing. If I do the surgery perfectly and you don't do the exercises, you will get a bad result. I guarantee it. So that was a pretty strong message. And I did the exercises.
Yes. Well, that was sure make me do my homework too.
Yeah, right.
Well, I also noticed you have another point that you were saying that when they recommend you post-op practices, you must follow them, right? I think you mentioned that. I mean, I know that after my cesarean, you had a baby, they say don't lift anything, and I really, really try to listen to that. But do you,
No, I think you're gambling with your health if you do that. I mean, there's a reason. You know, when you've had surgery, whether it's a cesarean or I had colon surgery or back surgery, I mean, it takes time to heal. And if you go
Layers
bending
of
over and lifting up,
yeah.
40-pound weights, you're going to put stress on those places in your body that are not ready. So yeah, I think it's very important to follow.
And I think part of it is probably being prepared for what will you do when you come home, so you avoid those things.
That's a good point, because the preparation for going home is not only physical, like get the chair in the place you want it before you go and get rid of the throw rugs or use double-sided tape to tape down the ends so you don't fall, or all that sort of stuff. But there's another level of being prepared, which is understand life's going to be different for a while. You're not going to be lifting things. And that, you need to realize that. You also need to realize that for fairly extensive surgeries, you're going to be pretty tired for a while. And so if you have a realistic expectation, then when you're falling asleep at 1 o'clock in the afternoon and you know you can't pick this up, you've got to wait for somebody to help you, it doesn't come as a shock. You were prepared. You knew it was going to be that way.
One of your advice was that don't expect to get any rest in the hospital. So why?
Well, first of all, I like to tell people they think that you're best off in the hospital. You've got all these doctors and nurses, but who's in the hospital? Sick people. So you don't want to be there. You want to get out, and the doctors get you out as fast as they can. But in terms of rest, there's so many things going on. Your vitals are being checked on a regular basis. You may have an IV running, and I guarantee you that at the worst moment, it'll start beeping, whether it's a real alarm or not, and then they come in and have to deal with that. And then you might get awakened again a few hours later if it's nighttime in order to take vitals again. Sometime the IV bag needs changing because it's empty, so they'll do that. And I cynically say I sometimes think they wake you just to be sure you're sleeping.
So they're sure you're
not much rest in the hospital.
I see. Well, that's a very important tip for us to know. For those who are so unlucky to not have ever been admitted in the hospital, they won't envy that or don't bank on
stay
it.
Home.
Well, Rich, thank you very much for coming on our program.
Thank you very much. I'm very glad to be here.
And thank you for joining us. And join us next time on Off the Shelf. So